Okay, now we're looking at the evolution of antenatal care. Okay, so evolution of antenatal care, because we are trying to look at this care that women get when they are pregnant. How far has it come, and like the improvements, various improvements that they have actually done on it. Okay, and how positively it's actually impacting us. So evolution of antenatal care, um, we said that it reflects a shift from us practicing it based on tradition, you know, to now practicing it based on what, evidence. Okay, so it simply shows that, yeah, we are much more improved right now. So we are doing things based on evidence, not just based on religious stuff. So of course the aim is to what, maximize the health of the mother and also maximize the health of the developing baby. Okay, so historical development, from before the 20th century to 1990s, care was largely informal, mainly by midwives and family members. Okay, it was just focused on hygiene and the woman should eat well. Okay, so this one, you could say that it's not really evidence based, but it's just like out of love. You understand? So visits were frequent too, like the visits were much. Do you understand? The visits were much in the sense that the woman could just come to the hospital. Now it doesn't care if something positive happened or not. Okay, so mid-20th, it was now restructured, and emphasis on routine checkups, but it lacked individualized care in the sense that everything that was applied to the first patient would be applied to the second patient regardless. So they didn't actually like tailor stuffs according to the patients they were dealing with. So later on, now there was now shift to evidence-based models. Okay, like they were now doing things based on evidence. You understand? So just 4 visits. Okay, so 4 visits, and each of the visits was now strategic. Okay, so in 2016, they increased the not visits again. It was more of like 8 contacts. Okay, so they now call it contacts, because visits, you can just come to the hospital, nothing happens, but the contacts make sure that you actually came to the hospital, you were attended to. Do you understand? So that's the difference. So in 2016 means that maybe I might have come to the hospital more than 8 times, but at least in 8 times you were attended to very well. Okay, your problems were heard and all of that. So antenatal care is well established. Okay, with widespread access to skilled providers. Okay, so they do screening, they try to access how the woman is eating, they try to know that the woman has she has a knowledge of what birth planning is, so that she's not just going on and on and on and giving birth to children without spacing. So low and middle income countries, their access remains limited. Okay, so it's not really cool as what we actually see on the, how will I put it, developed countries, as what we could actually see in the low income countries. So they have a lot of barriers, like they don't really have facilities. Some women doesn't even know that something like that exists, or even if they know that something like that exists, they don't really attach so much importance to it. Okay, so in sub-Saharan Africa, only about 49 to 53% of women receive more antenatal visits. Okay, not much of them receive visits again. Okay, so that's it for the evolution. Okay, how this antenatal care have come and the various improvements that they have actually done to it.